Wiggum. I'm the Managing Director of Hospital Products Australia. Founded the business back in 2013, a second-generation healthcare family. My role is to support the team and really guide their enthusiasm in helping deliver outcomes which are positive and beneficial for the healthcare facilities that we support, be it in aged care, hospitals, or day hospital procedure facilities. I'm a support guy. That's my job as managing director, just to be there to make sure that the team knows that they've got somebody who's got their back and is looking out for them as they look out for their customers and the people that they serve. I'd say the key moment in my career, and I've had a few of them, this is probably my third and hopefully it's my last, but the key moment would be joining healthcare or starting off in healthcare. And that was it was only recently, it was in 2011. My father had run a business in healthcare for pretty much the 70s. He'd worked in it, he'd been involved in it. I mean, essentially on my 21st birthday, I was treated to a trip to Germany and spent a week at Medica in trade halls. So look, I'd always been brought up around it, but I'd never sort of joined the business or got involved with it. But in 2011, I decided to take the leap. Took a pay cut, started off at the bottom as a rep, and I looked after Victoria. It was a fly-in, fly-out role. I was based in New South Wales. Had a newborn, wife was at home, and there I was travelling down to Victoria. But at that stage, Dad's business had won Royal Children's Hospital, so the fit out there. So I spent pretty much most of my time, a good 6 months in operating theatres, NICU, ICU, really learning the ropes, but becoming fascinated by the whole way that everyone works and how a hospital achieves the clear goal of treating and curing human beings. And what better important part is early life, so children. So I was fascinated, like in an operating theatre once, and there was like a team, I counted it, it was like a team of 18 people keeping this newborn alive, having its heart operated on. It was literally hours old. And it was a premature, and there was that many people there, and they all had a key role to keep that child alive. And I was blown away. And I knew at that point that is the industry that I wanted to be in and I wanted to be involved with. And I also wanted to be able to influence, if I could, change for the better. So help those 18 people do their jobs better. And I guess when HPA came into play, that was the core drive. It's to give the experts, the clinicians, the nursing staff, the people who keep hospitals working and functioning as they do, give them the tools, give them better tools to be able to do their job and perform their function daily very well. HPA was formed essentially by me not wanting to join another business. My dad sold his business. The opportunity was to join the new business that had acquired his business, and I chose not to do that. So I went out on my own, literally no clients, no business name, went on ASIC, found that Hospital Products Australia was available, registered it, and then started running from there. So I reached out to a number of suppliers that I knew globally, wrote a business plan, shared my dream. Some of them were interested, the majority unfortunately were not, but those that I will say were interested and are still suppliers of HPA today. And they've shared the success and also been a part of that success that we've had. So we really grew from just me. I remember my first order, it was a chair that I flew in from the US, from Homer Miller. And then I had some lucky breaks with a few other orders and then grew. So no borrowings, no money lent by anyone else. It was just primarily myself, not paying myself for a while. Had no facilities to really run from, but organically grew by actually success and achieving good outcomes from business. So a lot of luck, as I said. I remember one supplier paid a deposit, and that gave us the oxygen to grow. We evolved into a very much a digital mobile computing cart mounting business, and we very much succeeded in that. I remember one time I jumped on a plane to Taiwan just to secure a deal so we could actually gain the rights for a product. And that was over one day, and then did that. And the next day, I believe I was like signing a contract with New South Wales Health. So it's been a rapid ride, but we've grown rather rapidly. And saying that, over the last 7 years, and we've now got an extensive team based all around Australia. HBA is a distributor of capital medical equipment. We've actually got 4 divisions in our business, so 4 separate business units. One is patient monitoring and life support, so that could be anaesthetic machines, vital signs monitors, ventilators, which have been quite important to provide during the pandemic. We also have a surgical division that includes operating tables, theatre lights, endoscopy stacks, and imaging, and all digital operating theatres. Another core part of our business is our 3rd division, which is ICT, which is mobile computer carts, wall mounts, basically anywhere where somebody needs to interact with technology and communicate to the outside world, be it inputting data or accessing patient information. We provide the platforms for that. I'd proudly say we're number 1 in Australia in that. Probably a lot of our suppliers from around the world also think we're number 1 in the world at that. We're very innovative and we lead the way. Even the conversation we're having right now is on one of our telehealth carts. So I'm not tethered to a desk, it's completely mobile. And that's how we function and do very well. And then our 4th division is infrastructure, and that has become a very important piece in COVID, because we provide a lot of BSL 3-4 labs. We've also got pop-up, negative pressure rooms that we can convert hospitals into hospital wards into negative pressure rooms for surge capacity. We also have modular operating theatres and clean rooms. So I'm standing in one now in our Sydney showroom. And also our UVC lighting and mounts, which go inside the ceilings, which then scrub the air and clean the air. Very, very prevalent and important during COVID times. COVID-19 has presented a lot of challenges in healthcare, but also opportunities. We've found since the beginning of the pandemic, and that was quite an interesting time, because we just signed on as a distributor for a major manufacturer called Mindray for their surgical and patient monitor life support solutions. So we were able to actually source and actually provide essential ventilators to a major state government, and quite a sizable deal. So that changed our business. We obviously recruited a number of people to support that product line, and we've continued to do so. We've also found that during the vaccination period, we've been providing a lot of telehealth carts. So obviously, as you can imagine, in wards which are locked down and loved ones can't actually see the loved ones who are in bed, a telehealth solution like that we're recording right now from becomes a benefit. It also means that clinicians and practitioners can also be performing some tasks which are necessary via bedside without actually coming into close contact with patients. During the last couple of months where the vaccine rollout's been occurring, we've also been providing a lot of our digital and telehealth carts to the vaccine hubs, especially in New South Wales, where we've had a huge increase in the uptake of vaccinations, which is fantastic. And I'd like to add that our team, by their own choice, nationally has achieved a 100% vaccination rate. So it has changed our business, but I would say it's made us closer. We've been presented with challenges, even just on how to communicate with our customers. Everything's very much digital nowadays. So we've pivoted to that in regards to products demonstrations. But, the supporting the frontliners, that's been our clear goal and vision from HBA, because we know that, and a number of our staff, I will say, are qualified ICU or nurses, etc. And also their partners as well. They're on the front line as we speak. So, we're very, very much close to this. And, we're happy to support and do whatever we can whenever we can. HBA has a broad range of solutions that we offer to healthcare facilities, be it aged care, hospitals, even day procedure clinics. One of the key ones that we've provided recently is our mobile telehealth solutions, our carts. So we've been providing them to vaccine hubs, mass vaccine hubs, the large one out at Homebush, another one up at the Hunter, New England, which was and the team that put these together, that they did them rapidly. So I'm talking like within 24 hours of getting a phone call from New South Wales Health, can we get X amount of carts? And this solution provided our teams being able to work throughout the night, assemble these carts, put these things together and deploy them the next day. So that's been one of the key things that's been occurring, and solutions we've been providing to really assist the frontliners out there to help vaccinate the population, the general population. We've also been providing, negative pressure pop-up rooms for hospitals to protect caregivers. That's basically when staff are in a room and there's aerosols coming, be it from a ventilator or just by an unventilated patient. We're creating a negative pressure space for facilities to help protect caregivers. We're also doing that nationally. So there's a big major hospital in WA right now, which we're working with to come up with that solution for them that suits a whole ward. So it's been a challenging time, but also a real learning time. A lot of innovations come internally. A lot of the suppliers that we're dealing internationally have really worked hard to provide solutions that are centric to the Australian healthcare market and what we need specifically here. I have found it as a business owner quite challenging because, as you can imagine, supply chains have been pressured. So it's been not only expensive to get product here, but almost impossible. So we've been finding different ways, getting things on airplanes when they, probably couldn't have made it on there. So it's been challenging as a business owner, but really the team has come together very, very closely, and they're working for one goal, and that's to obviously get the lockdowns finished and get everyone vaccinated. HPA always considers itself at the forefront of change in healthcare. We really have, our belief is to challenge the market, not just accept what's there. So even with our suppliers, we're continuously challenging them, and some of them say, well, we don't do that. Well, we tend to not work with those suppliers and manufacturers. We tend to only work with those that are willing to sort of explore beyond and look for a new way of doing something. And so some of the innovations that I've seen that have spurred on from, be it team members who are actually in the Sydney office or Melbourne office, even in WA, are driven by what they're seeing in a healthcare setting. And then they're coming back and troubleshooting with the team and networking internally. And then we go to a supplier, often sometimes multiple suppliers, and then we get those multiple suppliers working together. So you might have a manufacturer in the US who will have working with one of our other contacts in the Netherlands to solve a unique problem. So I'm seeing, what we're pushing for, without giving too much away, is mobility and being able to access information without being tethered to a wall, removing touch points, so obviously touch points for infection prevention, so be it washable keyboards, not having to log on to a keyboard, the recognition of being able to be recognized by AI and being completely mobile in hospitals will help prevent future transmissible diseases. But it's also an efficient way of working. And that's what HPA is about. It's how somebody works in a healthcare setting. So be it, even if it's just, the CEO, how they're communicating with their team, all the way down to the supply doc. Every person's role in a healthcare continuum is essential for that whole operation to work. And that's where HPA is looking for solutions. And we do have quite a number of which are coming up to help everyone achieve the outcome of running an effective operation, which the clear goal is to help prevent and cure diseases.